Liposuction is not a procedure for weight loss. It is a procedure for inch loss. And that's what you are supposed to know and then come to a plastic surgeon. Most of the people have this misnomer that liposuction is used for weight reduction. However, the weight reduction or the fat reduction is the byproduct. It's not what we aim for. What we aim for is inch reduction. Now, let's understand anatomy. There is something called as a visceral fat, core muscles, and a somatic fat. As a liposuction surgeon, my area for treatment is somatic fat. We don't deal with core strength and we don't go inside the body cavities and deal with the visceral fat. The person who comes to my cabin and says, "Doc, kindly remove this fat, I'm going to eat more, I'm a foodie person," I say complete no to this person. But if someone will come to my cabin and tell me, "Doc, I've reduced some kilograms and this is the stubborn fat which I'm struggling with," these are the ideal patients to whom I offer liposuction as a procedure for their body contouring if they want to achieve certain kind of inch loss. At the same time, we get a lot of female patients and the male patients as well who know the use of healthy lifestyle, who know the importance of healthy lifestyle, diet and the exercise. They will come to us and request us to kickstart the whole procedure by removing some stubborn fat and going to maintain it and going to see more inch loss after our procedure. So we give our services to these two categories mainly. Either we go inside first and start the process, or someone has already done that by their own efforts of diet, exercise and lifestyle change, and we go and take care of the remaining fat cells. The visceral fat is going to go down by diet, exercise and lifestyle. The liposuction is never an alternative to your lifestyle and diet and exercise. It is always a complementary procedure along with these changes. When we talk about liposuction, again the most commonly asked question is about tissue laxity or skin laxity. "Doc, if I undergo this procedure, what is going to happen to my skin?" The body has a very beautiful quality of skin retraction. Now, for example, just imagine 100 women who have delivered the babies. You will not see a skin laxity in everyone because the genetic factors, there are skin qualities, there's a protein intake which matters, and of course there are certain lifestyle habits like smoking that deals with the loss of tissue elasticity. Similarly, when we remove fat from someone's body, we check the tissue laxity and the tissue elasticity. And the use of advanced liposuction like laser assisted liposuction and power assisted liposuction, we can actually give you some nice skin retraction. But if your skin has lost the elasticity to a certain extent, then we can offer something called as tummy tuck. In a tummy tuck, the loose skin is removed. We tighten the core muscles or the abs muscle which has been separated by the means of either pregnancy or increase in intra-abdominal pressure by visceral fat or many other reasons. And along with that, we change the position of the navel on your body. Imagine a mattress with a wrinkled bedsheet on it and there's a nail which has been hit in the mattress. Now if I want to tuck the bedsheet, unless I remove it from the nail, I won't be able to do the tucking of the bedsheet and give the crisp look to the bedsheet. Similarly, if the skin is crumpled and the navel is one point which is keeping it adherent to the inner muscles, I won't be able to give you the nice contour or nice hourglass figure. I have to separate it, stretch the skin down, take the extra skin out, tighten the muscle and re-drape the skin inside again if the elasticity is not well. So to summarize everything, liposuction is a very beautiful procedure when it comes to body contouring. It can give you permanent inch loss, and if you maintain the lifestyle with exercise and diet, you are going to see more inch loss in the successive years. Trust me, the lifestyle, diet and exercise are irreplaceable. Another most frequently asked question is, recovery process. Now the recovery process lasts from 7 days to 21 days depending on the body morphology. If someone who is very active in gym, who has done a lot of core strength, and those who doesn't have a lot of habits, like unhealthy habits, they recover very fast. We have certain individuals, those who have traveled to different cities and countries on the second and a third day of liposuction. At the same time, elderly female, little bit in 40s and 50s, those who have not undergone a lot of body work or a core strength work, they may see a delay recovery because the body is going to take some time to recover. And at the end of 21 days, my 80 to 90% of the patients, they recover well. To fasten the recovery, you are supposed to wear something called as a pressure garment, in which the skin is going to get pushed inside and allow it to retract. It will also avoid some water collection inside, which is known as a seroma formation. This pressure garment is also going to help you out with the pain management. We ideally give treatment, medical treatment, which is the pills to be taken for 5 to 7 days. Along with this, high protein diet is very much important, because when we do liposuction, your body is undergoing catabolism. There's a breakage of body tissue, and high protein diet is always going to help you out into all this. Very important thing is edema or a tissue edema. To decrease that, manual lymphatic massage and ultrasonic massage is going to help you out to decrease the tissue edema and get you in on your routine earlier. I ask my patient to resume their gym activity by 21 days. The basic activity can be started from the second day of the surgery, and the little bit aggressive activities can be started in the second week of the surgery. The scars of the liposuctions are always kept hidden, and they range somewhere between 4 mm to 8 mm. For tummy liposuction, we take the excess areas into the groin, which is always covered under the bikini or a panty line. The second entry point is in the umbilicus, and if needed, the third and the fourth, or the fourth and the fifth entry point rather, will be below the breast tissue. From here, we take care of the upper fat. From tummy area, from umbilicus, we take care of middle fat mainly, and to give some nice contouring in the midline. And the lower incision has been used to give or take care of the lower fat. Allowing your skin to retract is the most important task in the liposuction. Now, as we are progressing in this process, we started using advanced liposuction. What is the difference between simple liposuction or a traditional liposuction and advanced liposuction? Traditional liposuction is a procedure in which the hollow pipe goes inside the tummy below the skin and takes the fat out. But by doing so, we scratch the skin, we scratch the muscle, we scratch the fascia. It gives you the result, but it gives you edema, sometimes ecchymosis, and sometimes painful journey. So we started using the advanced liposuction. Advanced liposuction is basically using energy-based device to melt up the fat and then take it out on a simplified manner. So laser, ultrasonic energy, radio frequency energy, and mechanical energy are being used to do such kind of disruption of the fat cells. In Head and Shape Clinic, I, Dr. Umang Kothari, we normally use power assisted liposuction, which is a mechanical liposuction. Along with that, laser assisted liposuction. After doing the liposuction, I also use laser for skin tightening. There's a cherry tomatoes on a branch. If I'm supposed to break those cherry tomatoes from off the branch, and I have a bamboo with me, I'll try to figure it out and mingle with the branch so that all those cherry tomatoes are free. But in doing so, I may rupture some of the tomatoes, and I may do some harm here and there. Now imagine having an energy which is going to dissolve the branch specifically, and all the cherry tomatoes are free. And that's what the energy based device is going to do. They have the specific affinity towards certain kind of tissue, and when it gets loosened up, the fat cells are more free, so they are easily suckable without doing more damage to your internal skin and your muscle and fascia. Now since we are doing less damage, there's a less inflammation, less edema, less pain, early recovery. And that's what people want in the urban life. They want to get back to their routine life, as soon as possible. They want quick fix for certain kind of areas which they are not very much happy with. So advanced liposuction can ease out the journey. Also, many people tell that even the traditional liposuction we deliver the same result. Yes, there is no doubt about it. In an advanced liposuction, what we say is not the result. What we comment is on the journey of a patient.